Hey, what's going on, guys? This is your man, Dr. Fox, the Millennial Doc, back for another week. And so today I'm going to be talking about now you matched, okay? Now that you matched, this is match week. A lot of people are finding out exactly what residency program they matched into, where they're going to be going for the next 3, 4, 5, even up to 7 years, depending on what type of specialty you're going into. So this is really a big deal. First and foremost, I want to say congratulations. This is such a big accomplishment. It represents years of hard work. Okay, so I hope that you're happy with your specialty. I hope it's something that you've been looking forward to for a long time, or something that, even if you found recently in your third or fourth year, that, you can see yourself doing for a long time and being really happy with. So I hope you're excited about the residency program that you're going to, and even the location. But even if you're not excited about the location, I hope you're excited, like I said, about your specialty. We all have to make sacrifices, okay? Um, so just want to give you some little tidbits. You know me, I'm always going to try to, keep it 100 with you guys, let you know what I think, and, give you some real advice, okay? So you definitely want to be able to reach out to other people, okay? If you can, try to reach out to your future co-interns. A lot of residency programs will send out like mass emails to all the people that matched for that upcoming intern year. Okay, so if you have an opportunity, I think it's a good idea to try to reach out to your future co-interns if you can. Also, trying to reach out to some of the current residents, I think, is a good idea. I wouldn't overwhelm and try to email or reach out to everyone. If you went there obviously for the interview, and you got someone's phone number, and they said, hey, you call me with any questions, that would probably be the person that I would reach out to. The other thing is, if there are recent alumni of that program, I think it's a good idea to reach out to them, especially if they look like you. Okay. And then certainly reaching out to your mentors. These are the people that have had your back, and probably wrote letters for you. So you definitely want to let them know where you're going, because they're going to want to keep tabs on you as well. Okay. So the next thing is to enjoy your time. Okay. Enjoy your time between now and July 1st. When July 1st comes, it's going to get real. Okay. Residency is going to be nonstop. So enjoy your last little bit of freedom before you come an intern. Okay. Um, Next thing is, getting prepared. Okay. So at most, I would say from an academic standpoint, getting in some light reading is okay. I don't think you need to be one of those people that feels like you need to read the whole, you know, textbook of neurology or internal medicine or anything like that before you start day one. Okay, I think that's overwhelming yourself. You're going to have plenty of time to learn, the core principles of the specialty that you're going to be going into. Okay, so I think light reading is okay, but I don't think you need to go too hard. You're going to be want to take that time to just relax, rest. You got a lot on your plate with, finishing med school, with probably moving if you have to move, and getting some other things set up, and probably got to do a bunch of onboarding stuff for your residency program. So you're just going to have so much going on. So I don't think you need to put that extra pressure on yourself. The other thing is getting medical equipment, and really at this point you should already have that as a third or fourth year medical student. The last major point I want to talk about is just working on your communication skills. Something I don't think people talk about enough is, your communication skills are very important in your residency. Okay, just having good social skills. I'm not saying you need to be a social butterfly or anything like that, but in residency, you want to have good interactions with people. You want to be able to engage people. You're going to be in a unique circumstance where you're going to be going from rotation to rotation a lot of times. So your work environment is going to be different than other people that have jobs where they have a stagnant work environment and they come to the same place and they basically do the same thing. Your situation is not going to be like that as a resident. You're always going to be shifting from one work environment to another. You may be on a nephrology rotation, 1 month on a hematology oncology rotation, another month you may be on a surgery rotation, another month. I mean, depending on what your specialty is, and how your year is going to be set up, you're just going to be going through a lot of transition, and the type of learning that you do, or whatever your work practices are that work for one thing, and this is kind of similar to how med school is, may not work for the next thing. So you're obviously going to want to be that person that reevaluates what you're doing to see if it's going to be effective as you go to the next rotation. Okay. And then as your role changes, going from your intern year to all the way up to your final year of residency, um, what the things that are going to be asked of you are going to be pretty different. Okay. So you need to take that in consideration. As a PGY1, an intern, you're there to learn. You're just really there to be a sponge and soak up things, to be a good communicator, to be able to take an accurate history, and get a good report, and be able to do a basic examination, and then they'll teach you the things that you need to know going from there. Okay. So your credibility is going to be really important. Obviously, the people that are there, the current residents, the attendings, the nurses, they want to make sure that they can trust you. So your credibility is everything. Okay. And then the other reason why your communication skills are important is because you're going to have encounters, like I said, with so many different people, with your co-interns, with your senior residents, with your program director, who's your boss, basically with different attendings that you're going to rotate with the nurses, with the patients, obviously, with the families of the patients. So, you're really going to be in a unique position, because you're going to be dealing with so many different types of people, and then different types of personalities. And, that's going to be a challenge as well, is learning how to deal with different types of personalities. Okay. So, and that's going to require you to be somewhat intuitive and pick up on things. But I think for the most part, when you work with different people in the medical field, a lot of times they'll lay out what their expectations are. But if they don't, I think it's a fair question always to ask, well, what are you expecting of me? What can I do to do well, on this rotation, or to do well working with you, or to do a good job? So, I think a lot of people will lay that out. But if you're working with an attending physician, or if you're working with a senior resident, and they don't tell you what their expectations are, the onus is going to be on you to ask. Okay. You definitely need to ask. Okay. Some people are tricky like that. They'll just watch you make a mistake, and they won't say anything to you. So not everybody deals with you, I think, the way they should. So just take the onus on yourself to be more proactive in that kind of environment. Just ask them what the expectations are. And then, midway through the rotation, ask them, hey, what could I be doing better? Offer, ask for feedback, that kind of thing. Okay. So, well, all right. So that's it for now. I just wanted to provide, my thoughts on, what your approach should be, and, just uh, congratulate you, because, like I said, this is such a big step, and just take a deep breath and get ready for the next phase of your life. Okay. So, as always, I appreciate you guys watching. Please like this video, subscribe to it, tell other people about this, as I'm trying to really build this thing up, the Millenial Doc. And just keep watching, keep tuning in. Let me know if you have any ideas, questions, feedback. Definitely appreciate that. And just stay tuned for the next one. All right. Peace.